Welcome back to Park Avenue Plastic Surgery Class, the podcast where we explore controversies and breaking issues in plastic surgery. I'm your co-host, Doreen Wu, and I'm here with Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. We have an exciting episode in store for you today. The title of this episode is You Can't Return a Bad Face: How to Avoid Buyer's Remorse with a Facelift, Laser, Filler, or Botox. We all have a few beauty projects on our wish list. For some, it might even be more than a few. Regardless, in order to make our beauty dreams come true, we need to ask the question, what's the best way to approach things? How do we get to the right doctor and arrive at the right treatment to get what we want?
It's a tough challenge to go down this pathway and come out successfully. The nice thing is there are many, many options today, and there are many, many providers, but that also creates challenge to find the right answer and the right option. So to make your beauty dreams come true, or as close to it as possible with the current state of the art, is a real job that requires some commitment and time up front, so you don't wind up frustrated, sad, broke, or even worse, just looking bad. That, of course, is the last thing we want when we do any kind of plastic surgery, treatment, or procedure. The goal is to get you looking better. So the first consideration is how to pick the right doctor. And that's really about qualifications, experience, and verification that those qualifications are real. There are several different specialties that, as part of their baseline training, have formalized didactic and clinical training in aesthetic treatments and procedures. These are called the core four specialties: plastic surgery, dermatology, facial plastic surgery, and oculoplastic surgery. There are other providers who did not formally train in aesthetic treatments that may have picked up the treatments later, and some of those individuals can really be excellent, but it's harder to know what experience they had that made them qualified to do the treatments, and whether that was a lot of experience or a little experience. Even after that training, having experience in clinical practice to refine your techniques and get predictable results is really important and makes a big difference. Finally, there are a few providers out there who are either putting up a credential that doesn't really represent something significant, like a board certification that's not from an accredited board, or that just have out-and-out fraudulent qualifications. Now, the nice thing about that is nowadays with the internet, it's easy to go on the state licensing website for medical licenses, to go to the board website of the American Board of Plastic Surgery and see if that person in fact has an active valid license, see if that person is board certified and has maintained their certification in the specialty you believe them to be providing.
Okay. It sounds like there are a lot of excellent qualified providers out there, and part of the onus is on the patient to go out there and research and see which provider has the qualifications and the experience necessary. How can I tell which doctor is going to give me the results that I want and actually make me happy?
Well, that's really a loaded question, Doreen. I mean, happy is a state of mind, and it doesn't really relate to any particular technical qualification. But there are some questions you should ask when you're looking for a provider and as you start to meet them, to see if they're in fact the right fit for you as an individual. Because there are many providers who are really excellent at what they do, but you're not going to enjoy working with them. Better to find somebody that you can partner with for the long term, who's going to take an approach that you find comfortable. First thing is, I always like someone who is real about what the treatments are. So there are real world treatments which help but are not perfect, and there's no magic wand treatment. Some people are looking to be told they're going to get the magic wand treatment, that everything's going to be perfect, but of course that doesn't really exist. When you look for a doctor to work with, some people want someone who will tell them what they need. They're not comfortable partnering in the decision making. They want the expertise of the doctor to supplant their view of what is good or bad about their appearance. And that's okay if that's who you are as a person and you want a doctor who will just guide you through the process. That's okay. Other people want to partner in the decision making with their doctor, and that's sort of a consumerist approach. That's an approach that I take in my practice, and I tend to like people that read, have information, and want to understand what's happening so that we partner together to make a decision amongst all these different options that are available nowadays, which decision is the right one for you as an individual. Of course, you want someone who's honest, who's going to give you an honest and real-world answer, someone with technical excellence. Some people look for leaders, a department chairman or a very notable plastic surgeon who lectures quite a bit. I spend a lot of time doing research and lecturing, and there are pluses to that. That means I'm a super expert in certain things, but there are also minuses. I'm out of town part of the time and not as available as a local plastic surgeon who doesn't spend time in academic activities. So there are trade-offs there to having someone who's a high flyer, so to speak. And then you have to decide how much of a priority is having a lot of experience. And of course, the priority always has to be about the results, because this is about getting good results and looking better at the end of the day.
It seems like there's no one right provider for everyone. It really depends on what you're looking for. That leads me to my next point. How should I go about picking the right treatment or procedure? I read about all of these great new things in beauty and fashion magazines and on the internet. Sometimes I wonder if I should be looking for a provider who is an expert in the latest new thing I spotted, but then I get overwhelmed by all of the choices and information. Tell me, how can I sort through this?
Well, new technology is great, but it's not always the right answer for your individual problem. I do a lot of research in developing new technologies and figuring out how to apply them. So I like new technologies, but I like to pick what's best for the individual patient, not necessarily what's new. Some new things are revolutionary. They really change what we're able to do for people. And a lot of new things are just evolutionary. They're similar to what we did before, but a little bit refined. So we like that, but that doesn't magically transform what we can do for people. I think the most important thing is to pick a provider who listens to you and hears your needs. That's your best bet to get your beauty dreams to come true. Because if the provider doesn't hear what you're looking for, or if you're just chasing down a hot new technology, then you're more likely to pick a procedure that's not going to really give you the best result or really drill in on the problem you're trying to solve. It's always a good idea to be open to what providers suggest. Plastic surgeons each have their own approach, and they know what they can best do, which may be different from what another plastic surgeon does for the same problem, but both surgeons may get great results. So that's an important point, and as long as we're realistic about what the limits are for each treatment, because we'd like to make everything completely back to the way it was when we were 20. But we're not able to do that with most of our treatments, although we can make really substantial improvements that are very worthwhile. Everyone hears that and they say, oh, I don't need to be 20 again. But what that means is the feature you don't like, that you're spending the time, the money to correct is better, but it's not all better. Some of it's still going to remain. So that's what I mean when I say realist.
Speaking of limits, it's really easy to look overdone. We've all seen the photos of people who go a little overboard and have too much done or who no longer look real or like themselves. It almost makes me want to opt for the safe route and do the simple treatment to avoid any inconvenience. And then there's that balance between not doing too much, but also not doing too little. It feels like I'm being asked to control my diet without knowing how many calories are in the food itself. I'm curious, in your opinion, what's the best way to avoid doing too much? How can I create the look I want, but keep it subtle enough so as to not warrant unwanted attention? After all, I want people to admire my appearance, not criticize them.
Yeah, this is a critical issue. And it's an American sentiment that if a little is good, more is better. And of course, that's not always true. And very often in plastic surgery, it's not true. The way people get into trouble is by doing treatments too often. That's bad for a number of reasons because it's a lot of trauma to your tissues. There's a standard typical increment of time between treatments, and when you're doing it considerably more frequently, you're risking looking overdone and starting to create tissue damage. There's doing too much. Again, if a little is good, more is not necessarily better, but we want to push as hard as we can, get as much correction as we can while looking perfectly natural. But there's a point where we have to accept that we're not yet perfect. As we said, every treatment leaves a little bit of undercorrection. By doing more, we don't get more perfect, we just start to look unnatural. So it's natural to want the most correction we can get, but we have to accept a lack of perfection. This is a hard thing for plastic surgeons and plastic surgery patients. We're all perfectionists by temperament, or we wouldn't be here. But this is a reality of life, not just in plastic surgery, it's universal, and we get into trouble when we push too hard. Some people do too many types of treatments. They're putting energy and fillers and skin products and needling and all kinds of things in the same skin at the same time. Now, multimodality treatments in proper amounts are actually a really good way to maximize the clinical result. But again, too much at once in the same place is another way to look overdone. Also, the last two things I want to mention is, each treatment has its expected intended result. And if that's what you're hoping to get out of the treatment, you're likely to succeed. But if you're hoping for something that the treatment is really not designed or intended to do, just by pushing harder with it, almost for sure you're going to look unnatural, and you also increase the risk of complications. So that's a bad place to go. The final thing is the artistry of the provider is really, really important. It's not just that filler is good or filler is bad, but it's how skillfully it's applied, and that frankly makes a really big difference. And a simple example of that is if you gave a paint set to Rembrandt or a paint set to a 7-year-old, either way you'd get a painting, but the paintings are really not going to be the same quality. And that's not really the fault of the paint, it's the fault of the artist.
That's a great metaphor, and that's really sound advice about how to rein things in. But now I'm worried. What if I'm not doing enough to look my best?
This is much tougher. There's much more variability here, and there's no bright line between what's good and what gets you into trouble. Different factors affect how much you're going to choose to do. Your budget, how your beauty thermostat is set, how much of a beauty issue makes you upset, exactly where you are in the progress of aging, and your lifestyle and capability to spend time and recovery time for various treatments. Still, there are a few keynote ways that people perennially underdo things and get an inadequate result. And, that's typical if you do one laser treatment when it's typically done as a series of 3 or 4. Predictably, you're going to get an inadequate result. If you could get the result in one treatment, people wouldn't be recommending 4. So it's really important to accept that up front. If you commit to do that series, you're not going to get where you want to go if you don't complete the series. The same idea with filler. If you're 30, 35 years old, you may only need a small amount of filler, but if you're 50, 60, 70, 80 years old, the volume of filler that's going to be needed to create an adequate correction is predictably going to be greater. So underdoing things is predictable failure. If you can't do what it takes, avoid the waste of time and money of just trying a little. You see the same thing with surgery. Sometimes a 75-year-old will come in and say they don't really think they need a facelift or a neck lift yet. They just need a little skin tightening. Well, at that stage, they're not really a good candidate for a lot of the energy-based treatments because skin tends to be less responsive, and most people, if they've followed average aging, actually have more than enough laxity that they're a good candidate to benefit from a surgical lift. So it's important to understand what features of appearance bother you, be analytical and be specific, and then partner with your plastic surgeon to figure out the best option. Unfortunately, our body image is fixed in how we looked in our late 20s. So when we picture ourselves, that's what we're seeing in our mind's eye. And if we're 50 or 60 years old, we know we don't look that way anymore, but when we think about ourselves, we still think that same appearance. So we have to accept that we're not in that place anymore. And if we want to make a positive change, we have to look realistically at what our appearance is like to the outside world.
So, Dr. Bass, now that we have explored some common pitfalls that patients encounter in plastic surgery and how to prevent them, what do you think are the most valuable takeaways for our listeners from today's episode?
Well, again, in picking a provider, it's always good to remember if a result that's promised is too good to be true, it's probably not real. If a provider's not listening to your issues and your perceptions, they're probably not going to focus and drill in on a treatment that's appropriate for correcting it. It's okay to compromise with treatments as long as you're aware of what the trade-offs are in that compromise. And I like the Goldilocks principle. Overall, not too much, not too little, just right. A good provider will help you hit the Goldilocks sweet spot for your individual needs and circumstances.
This is Doreen Wu, thanking you for joining Dr. Bass and me for this discussion of how to avoid buyer's remorse with a facelift, laser, filler, or Botox. Be sure to check out our next episode, where we discuss doctor shopping and the pitfalls of switching doctors for each treatment or getting too many second opinions.
Thank you for joining us in this episode of the Park Avenue Plastic Surgery Class podcast with Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. The commentary in this podcast represents opinion. This podcast does not present medical advice, but rather general information about plastic surgery that does not necessarily relate to the specific conditions of any individual patient. No doctor-patient relationship is established by listening to or participating in this podcast. Consult your physician to advise you about your individual healthcare. If you enjoyed this episode, please share it with your friends and be sure to subscribe to our podcast on Apple Podcasts, Google, Spotify, Stitcher, or wherever you listen to podcasts.